Welcome to the Explainer. Today, we're going to break down a really core concept in pharmacology, autonomic drugs. We are going to untangle the difference between adrenergic and cholinergic medications, and I promise, make it all crystal clear. So let's just start with a simple question to get our heads in the right space. When your body needs to act, does it have an accelerator or a brake? Well, the answer is it has both. And honestly, understanding that one simple fact is the key to everything else we're about to cover. I want you to think of your body as having two totally distinct operating systems. On one side, you've got the sympathetic system. This is your fight or flight response. It's the accelerator, it revs you up for emergencies. And then on the other side, you have the parasympathetic system. This is your rest and digest mode. This is the brake, designed to keep things calm and running smoothly in the background. Okay, so where do drugs fit into all this? Well, this is where pharmacology gets really cool. We've got two main families of drugs that are designed to intentionally press that accelerator or hit that brake, giving doctors some pretty amazing control over these systems. On the surface, it seems super simple, right? Adrenergic drugs go after the fight or flight system. That's like putting your foot on the gas. And cholinergic drugs target the rest and digest system, basically applying the brakes. But as you're about to see, there's a little more to it than just that. The first type of action we need to know is called an agonist. Now, what the heck is that? Well, simply put, an agonist is a drug that finds a receptor and flips the on switch. It activates the system. It turns it up. Think of it like pushing a button to make something happen. And then, of course, you've got the exact opposite, a blocker, which scientists will call an antagonist. This one does the complete reverse. It latches onto that same receptor, but instead of pushing the button, it just gets in the way. It's like putting a cover over the button so nothing can push it. All right, you ready? This is where it all comes together. When you combine those two systems, the accelerator and the brake, with those two actions, activating and blocking, boom, you get four distinct categories of drugs. Let's break them down one by one. First on our list, adrenergic agonists. So let's break that down. Adrenergic is our fight or flight system. An agonist means returning it on. So these are the drugs that literally slam on the gas pedal. Let's peek under the hood here. These drugs work by stimulating your body's alpha and beta receptors. The classic examples you've probably heard of are epinephrine, used in emergencies, and albuterol for asthma. And when you amp up the body like that, it just makes sense that you might feel your heart racing, that's tachycardia, or maybe even feel a bit anxious. And this direct stimulation is why these drugs are, no joke, lifesavers. They can literally force open the airways during a really bad asthma attack. They can crank up dangerously low blood pressure if someone's in shock. And they can even help restart the heart during cardiac arrest. Truly powerful stuff. Okay, so we've hit the accelerator. Now what happens when you block it? That's where adrenergic blockers come in. They basically put a brake on that whole fight or flight system, calming things way down. So check this out. By jamming up those same alpha and beta receptors, these drugs do the complete opposite of the agonists. Drugs like metoprolol and propranolol are famous for lowering heart rate and blood pressure. And if you're slowing things down, well, it's not a huge leap to see why side effects might be a really slow heart rate, that's bradycardia, or just feeling kind of wiped out and fatigued. And here's the takeaway, the why this matters part. Their use is absolutely widespread for managing chronic conditions. They are a true cornerstone for treating hypertension, high blood pressure, and for getting irregular heart rhythms called arrhythmias back under control. All right, let's switch gears. We're done with the accelerator system for now. Let's talk about the brake pedal, that rest and digest system. What happens when we push that pedal using a cholinergic agonist? These drugs get to work by stimulating what are called muscarinic and nicotinic receptors. Activating this parasympathetic system basically gets all the juices flowing. We're talking more bodily secretions, things moving through your gut, which, perfectly explains why the side effects could be diarrhea and a lot more sweating. So you can see these aren't your everyday all-purpose drugs. They're used for really specific problems. For example, they can help patients who are having trouble with urinary retention. And as eye drops, they're fantastic for treating glaucoma because they reduce that pressure inside the eye. And that brings us to our final category. What do you think happens when you block the brake, when you stop the rest and digest system from doing its job? You probably guessed it. You start to get effects that look a lot like fight or flight, but we get there through a totally different roundabout way. By blocking those parasympathetic receptors, these drugs dry things up and slow things down all over the body, and that right there is why the side effects are exactly what you'd expect. A really dry mouth, maybe some blurred vision, and yeah, constipation. And this is just a perfect illustration of their uses. They can calm down an overactive gut in something like IBS. They can be used in an emergency to speed up a dangerously slow heart. And of course, the classic one, a drug like scopolamine is famous for being super effective against motion sickness.
Whew, okay, I know that was a fire hose of information, but don't even worry because I've got a killer way to make all of this stick. We're going to use 4 super simple but really powerful mnemonics that'll help you lock this stuff in your brain for good.
So, for adrenergic agonists, the ones hitting the gas pedal, the phrase to remember is amp up the body. Easy, right? It's all about ramping up that fight or flight response. Next up, for adrenergic blockers, the ones that block the accelerator, just think break the heart. It points you right to their biggest job, slowing down the heart and lowering blood pressure. Now for the cholinergic agonists, the drugs that activate the rest system. This one might be my favorite, chill and spill. Chill for the calming effect, and spill for, well, all those extra secretions we just talked about. And last but not least, for the cholinergic blockers, the ones that stop the rest system, just remember the effects, dry and slow. It's the perfect little reminder of what happens, dry mouth and slow digestion. All right, let's put it all together. Time for a little pop quiz. Think about what motion sickness feels like, that feeling of overstimulation, right? So, based on those mnemonics we just learned, which one of these 4 drug classes would be the perfect tool for that job? I'll let you think on that. Thanks for joining us for this explainer.